4th, 2020, regular but remote Board of Health meeting to order. It's now been 9 months that we've been meeting remotely. I have no predictions when we'll be able to go live. And at least for now, the pandemic is not getting any better. Board of Health member Libby Wollengevitz will represent everyone in reciting the Pledge of Allegiance.
Thank you, Dr. Chairman. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much.
You're welcome.
I'm Ed Weiner, and I'm chairman. And remotely, we have David McSweeney, who is vice chair. Dr. Wayne Saltzman is a member. Libby Wollengevitz is a member. Mary Beth Welch will not be with us this evening. In addition, we have Susan Luminello, our Director of Public Health, Christine Mathis, our Environmental Engineer, Marlene Johnson, our Health Agent, Sarah Quartermash, who's our Board of Health Administration professional and our IT person tonight, and of course, Dawn Cathcart, who is our recording secretary. Thank you to all of the outstanding BCAT professionals who work so hard to make this program and other news programs and political programs so possible for the community. We're still operating in a declared state of emergency with special rules for public meetings. Mr. McSweeney, Vice Chair, will provide the legal requirements for tonight.
Thank you, Mr. Chairman. Pursuant to Governor Baker's March 12th, 2020 order suspending certain provisions of the opening meeting law, General Law, Chapter 30A, Section 20, and the Governor's March 15th, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Burlington Board of Health is being conducted via remote participation. No in-person attendance of the members of the public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in this order. A reminder that persons who would like to listen to or view this meeting while it is in progress may do so by tuning into the BCAT Government Cable Access channel, the BCAT Government Meetings Facebook Live feed, or over the telephone at 408-418-9388, meeting number 173-038-6980. That's 408-418-9388, meeting number 173-03-86980. Also, we will be monitoring the comments on Facebook Live to see if there's any that we wish to address. And as a reminder to the board that all votes are required to be done by roll call for the virtual meetings. And that's it, and that's back to you, Mr. Chairman.
Thank you, Mr. McSweeney. Again, please note we are live on BCAT and available for comments and questions through this video technology. A quick comment, as most of you know, every remote meeting and chairing remote meetings are not easy. Preparation is many times that of an in-person meeting. Please understand, all of us, we're doing the best we can. In this pandemic, we're all in this together, and I want to thank you all. We have minutes from November 10th. Are there any comments, omissions, corrections, or additions? If not, is there a motion to approve?
So moved.
I have a motion from Ms. Wollengevitz, second by David McSweeney. All in favor? Mr. McSweeney?
Aye.
Dr. Saltzman?
Aye.
Ms. Wollengevitz?
Aye.
And I vote aye, 4-0. We are at citizens' time. Is there anybody who is on the call or on the phone who is not on the agenda who would like to speak to this board? I'll ask Ms. Cathcart, is there anybody there?
There's no one on Facebook.
Thank you very much. We now go to this chairman's report, and I have noted earlier, lots been going on. These times tend to be and continue to be extraordinary, And as I and my Board of Health colleagues have said before, the coronavirus and COVID-19 is not going away quick enough. We continue to face many never-be-seen challenges, but the Board of Health is meeting all of those challenges head-on, using innovative plans that we developed quite a long time ago, well before this pandemic. As an indication, although surrounded by communities in the red of the state COVID map, Burlington remains to be in the yellow. I need people to understand, and I was asked to repeat this, over the past weeks, in addition to all that we need to do to keep this town safe, and we continue to perform all the duties also of public health organizations. That includes things like the town development, site plans, subdivisions, environmental issues and inspections, household hazardous waste issues, health inspections, biotechnology permitting, communicable disease review and actions, and this goes on and on and on. Our Burlington Reserve Corps, more than 180 people strong, have assisted in so many ways. And we have daily discussions with the school committee and school leadership. And I talk to the town administrator all the time. Between the town administrator, our chairman of the school committee, who works so hard, and of course, Susan Luminello, who never stops, never seems to be able to take a break. We're working very, very hard to keeping this community on track. We respond to many, many complaints involving the pandemic, and we take so many questions from the town. Yeah, the Board of Health has been and continues to be both in the forefront, and I really want to thank everybody who's done so much for this community. I just have one other comment. Our announcement that we'll be seeking an additional permanent Board of Health position, an Associate Director of Public Health, has been pretty well received in the town. I've had a lot of questions. I've spoken to elected officials and town meeting members explaining our need. I'm asking that every Board of Health member reach out to your colleagues in the town meeting and colleagues on other boards to make sure they know why we need another position. And last, in the past week, our Director of Public Health and I have been interviewed in 2 BCAT programs. I think the town knows how busy we are. So I'm asking if any board members have any comments, questions. I'll entertain them now. If not, we'll move on to subcommittee reports. And I know in subcommittee reports that Dr. Wayne Saltzman has something to present. Dr. Saltzman.
Thank you, Mr. Chair. As we discussed in the past, the idea of racism as a public health issue, and we paired with representatives from the school committee to create a subcommittee to look at this more fully. And now the schools do have someone who is focused on diversity and is going to help promote an understanding of how we create equity in our town. I wanted to bring to my colleagues on the board and to our community's attention that I think the Board of Health can take one step further. And Mr. Chair, I have to tell you that I was quite taken by the American Medical Association, who on November 16th actually made a formal statement. I'm not going to read their statement. I'll read pieces, but I think it really serves as a signal that that things are changing in our society, or that there are individuals and societies that are interested in promoting change. And part of the statement reads that a new policy was adopted by physicians at the American Medical Association's special meeting of its House of Delegates, which recognized racism as a public health threat and were committed to actively work on dismantling racist policies and practice across all of healthcare. And no one in our communities, no one really in the United States should be unaware of the significant racial disparities that have occurred, not just with regard to COVID, but also with regard to law enforcement. And so the new policy, which was approved by the American Medical Association, opposes all forms of racism as a threat to public health and called on the American Medical Association to combat racism by 5 methods: acknowledging the harm that it has to our healthcare and medical research, identify tactics to counter racism and mitigate its health effects, to encourage medical education, to support external policy development and funding for researching racism's health risks and damages, and working to prevent influences of racism and bias in health and technology innovation. Many of these things the Board of Health is involved within our own community. And so I would offer to my colleagues on the board that I think that a more formal statement from the Board of Health acknowledging racism as a public health emergency and pledging to work towards identifying further identifying inequity in our town, in our community, and helping to normalize that over time, working with the schools and working with other community partners is warranted. Now, Mr. Chairman, in closing, I should say that some would view this as a statement that does not coincide with previous statements I have made with regard to our Board of Health being a municipality that carries out statutes and regulations from our state versus a public health entity, especially when we were asked to make statements about marijuana use in our town. And as chairman, I had said that I would not condone the Board of Health taking a stance in that manner, as it was not consistent with our realm. I believe that racism is a very different topic, and that it does fall under the Board of Health purview and its role, while also as a public health statement. So I would offer that, in fact, I'm not being inconsistent if someone raised that argument, but once again, I would bring to my colleagues on the board the idea that perhaps we should make a statement in accord to the American Medical Association and many other entities within our society, as confirming that racism really is a public health emergency. Thank you, Mr. Chairman, for this opportunity.
Thank you. Very well put. Do my board members have any comments?
Yeah, Mr. Chair, just a quick comment. First of all, Dr. Saltzman, thank you very much. I know you're committed to this cause as relates to public health, and I'm fully supportive. I agree. I think it would be wise and also the right thing to do for us to make some sort of public statement and on behalf of the board. But also, Dr. Saltzman, are there other things that we can do? And I don't know, I'm just thinking off the cuff of what else can we do? Just talking about it sometimes helps spread the word and helps support the message, right? Make a public statement. But I would be encouraged to even help if there are other things that we can do as a board to help promote the message.
Yeah. So, Mr. McSweeney, thank you for your comment. I absolutely agree with you, but I am one, especially in our local political environment, that would want to take baby steps in making a statement first, and understanding that our Board of Health staff, which would ultimately bear the brunt of carrying on any further activities, is currently fairly well stressed with the COVID-19 pandemic. But we have access to our Medical Reserve Corps, which could help in this effort, I'm sure. We have the ability to do public speaking throughout the community and advocacy. Of course, utilizing our partnership with the schools is key. We have our annual oh gosh, director, our what do we formally
Health fair?
Health fair.
have our annual health fair. If we were to get another intern, maybe this is something an intern can work on for more of a.
Love that idea. Yeah.
I think we have the means. The last thing I want to do is stress our Board of Health staff, which is already working tremendously, as Dr. Weiner already said. But I think we can do many things. But I think there needs to be, with every journey, a first step. And I think the first step is to make a formal statement if the wisdom of the board chooses to do so.
Dr. Saltzman, this is what I suggest. I suggest that you and your subcommittee member, who I believe is Mary Beth Welch now, that you come up with a formal statement that we adopt at the next meeting, something that we can vote on, something that we can place on our website, and something that we can post throughout the town, throughout every board. So each board has a copy of our statement and our, if you will, mission around racial disparities and racism. So I know how well you write. I know that we have a director of public health who writes well as you have Mary Beth Welch, another member who is a professional. And if you could put something together, I would like to adopt a formal mission, if you will, and we take that up at the next meeting. I think that I don't want to just do this and then write it. I would like to actually have a statement and publicize that we'll be adopting it at the next meeting.
Thank you, Mr. Chair. I'd be happy to do that and work with Mrs. Welsh on that. And I'm going to opt not to reinvent the wheel, but to seek out other statements and find some commonalities, but make something unique for our community that we can vet further. So thank you very much.
Thank you. Our next order of business are variances, and the first, the only one, is White Coconut Thai Restaurant. And presenting that this evening will be Marlene Johnson, who is our health agent. Ms. Johnson, can you introduce the people who will, from this restaurant, who will be speaking this evening?
Sure. So Mr. Pongchiwin, he is the manager of the restaurant. Could you wave and say hello so people know who you are? Great. And then the gentleman to his right, I don't know your name, but I understand that you're the sushi chef.
Yes. Yes.
Would you introduce yourself?
Yes. My name.
Yeah, what is your name, please?
My name is Sharan. The last name is Tawasap. I'm the sushi chef. Have the
Okay, thank you very much. Ms. Johnson, please present the variance.
Sure. So Mr. Pongchiwin, he is the manager at the White Coconut Thai Restaurant, which is located at 211 Middlesex Turnpike Extension. And they've been in business for a while. They specialize in Thai cuisine. and they want to add sushi. So when adding sushi, because there are some requirements for the food code, and one of them is to come before the board and request a variance, and the other requirement was to provide a hazardous of analysis of critical control point, which is known as a HACCP plan, to me, and I did review that, and I approved that. And their pH of the rice. So those who are listening who may not understand what this is all about. So when you are making sushi, in order to make the sushi, you need your rice to be at room temperature. And so rice is considered a temperature control for safety food, and normally would require it to be either kept hot or cold. So the variance is to allow them to hold it out of temperature control. And one of the ways that they can do that without it growing bacteria is to change the pH. And so this is a variance for acidification. So with the recipe and the laboratory test, that pH came in at 4.19. So for bacteria not to grow, it has to be below 4.6. So my recommendation to the board for this variance is to approve it. And I have some conditions, 1 through 9, and I know the board has that information in front of them. And Mr. Pong Chi-Win also has a copy of the conditions in front of him, and he has agreed to those.
Very good. Do we have any questions or comments?
Mr. Chair, just a couple of questions for the applicant. I believe, if I can remember correctly, when they were in front of the Board of Health, or maybe Marlene, you can help here as well, but Mr. Pontuin, I believe you owned a second restaurant prior to coming into Burlington? You had a restaurant prior to that, or I still do, I think?
No, he's the manager.
Oh, he's the manager? Oh,
Yeah,
sorry.
he's the manager there, yeah. So
Okay.
he,
Own one in Bedford
In Bedford?
before. Yeah, in
Okay.
Bedford.
So do you
Yeah,
have
now-
it, do you have a history of working in establishments that have sold sushi? And I guess what is the sushi chef's background? How long has he been preparing sushi, and where has he worked prior to this?
He have the 10-year experience about the sushi. Yes. I
10
need to
years,
check.
10 years experience? Okay.
Yes.
And you have knowledge, the sushi chef has knowledge of, managing the pH levels and how to use the pH. What is it? I don't know what the pH monitor is called.
pH meter.
pH meter. I
Yes.
guess that was close enough. Can't get more simplistic than that. And you have experience doing that, and you know you need to keep logs, correct?
Yes. Right.
Yeah, okay. Okay. No other
Thank you.
questions, Mr. Chairman?
Thank you.
Thank you.
Dr. Saltzman or Ms. Wallenchevitz?
My only question, Mr. Chair, is a question you usually ask, and that is about where the fish is, where you get your fish, how your fish comes prepared, or comes prepared for you to make sushi or sashimi. Fresh.
We have the supplier from the Martinez Seafood. Yeah.
And does
They
it come
prepare-
frozen? Does it come frozen, so there are no parasites, or do you freeze it?
Yeah, come with the frozen.
Okay.
Yes.
I find, just to let the board know, I find that a lot of sushi operations now, they don't freeze it on site. I haven't seen that for years. I think that the vendors now all have kind of taken ownership of doing that for them, which
Thank
is
you.
actually better.
Yes.
And one quick question for Ms. Johnson, Marlene. You'll ensure that they know how to use the pH meter or the pH papers. We've had some situations where you have to, there's some people who weren't in total understanding on the calibration of the units.
Right, so we'll go over all of that before they actually start the operation. I'll go in and do an inspection like I usually do, and we'll go over everything, and that gives me a good opportunity to see how well they know what they're doing, and if they're following the HACCP plan that they submitted to me.
Okay. I have no other questions. Does anyone else have a question? Oh, and
Mr.
just for people who may not know, HACCP stands for Hazardous Analysis of Critical Control Points. So that's HACCP, HACCP.
Mr. Chair, I would make a motion to approve the variance for White Coconut Thai Restaurant to the Middlesex Turnpike extension to use acidification to store sushi rice out of temperature control.
Second.
And that is with the recommendations, correct?
Absolutely.
That's with the recommendations.
Absolutely.
I'll put that to a vote. Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Ms. Wallenjevitz,
Aye.
and I vote aye, 4-0. That is, we have approved it. And what is the next step, Marlene?
So what I'll do is I'll contact Mr. Punctuing and or schedule an inspection to come out when he and his chef are available. And then at that point, I'll hand them they have a new permit because we add sushi to that permit. So I'll give them the new permit at that time. So I'll be in
Thank you.
touch with you tomorrow, Sherry Chai. I'll call you tomorrow.
Yes, thank you.
So
Thank
Mr.
you.
Punctuin, thank you so much for coming, and we wish you well.
Thank
Be
you.
safe and be well.
Yeah, we will. Thank you very much. You helped me. Bye-bye.
Okay, our next agenda item is discussion, proposed changes in the stormwater bylaw, the Conservation Commission. We'll leave it with Mr. Larry Cohen, who is the chairman. Are you going to present, or is it your staff will present? Mr. Keeley?
It's going to be me. It's Eileen
Yeah.
Coleman. Thank you.
Oh,
Mr.
Yeah, our staff will be,
I'm sorry.
yeah,
I'm sorry,
Eileen Coleman will probably be the main presenter, and John Keeley and I are here for any additional comments if appropriate.
Thank
Okay,
you so
that's
much.
exactly what I'm going to say. I was just going to give you a very brief background to explain where the changes are coming from and why we have a bylaw in the first place. And then we're happy to either myself or John Keeley or Larry Cohen will be around to answer questions. So to step back, stormwater is regulated by the EPA under the National Pollutant Discharge Elimination System program. And under that program, there are a few different types of permits, one of which is the Municipal Separate Storm Sewer System program. So, not program, storm sewer system permit. So, stormwater in Burlington is regulated under our MS4 permit. That's the acronym for Municipal Separate Storm Sewer System. The previous permit went into effect in 2003, and that permit required Burlington to produce a bylaw that regulated stormwater in construction and post-construction development, in development redevelopment projects. And Larry Cohen, in fact, was the main author of that bylaw. So that went into effect, that was adopted in 2006. And then fast forward a few years and the EPA has produced an updated permit. That permit went into effect in 2018. And the new MS4 permit requires us to make additional changes to the bylaw. And those changes have to be at least as stringent as detailed in the permit. And the required changes extend to the design of stormwater management in new developments and redevelopments, and also require low impact strategies to be implemented unless infeasible. I'm happy to go through the proposed changes to the bylaw, which I believe you guys have received, or John and I are happy to take some questions if you just have some clarifications that you'd like from us.
I'll leave this to my board. I have read it very closely. I do have a number of questions, but if you'd like her to go through all the changes, I'd be happy to ask them to do that. I see Dr. Salzman saying no. I say no from Libby Wallenjevitz, and I'm looking for David. And David is saying no. So then let's open it up for discussion. But before we do that, our environmental engineer, Christine Mathis, has spent a lot of time going through this and has been speaking to, I think, Mr. Keeley about it, about our concerns. And is she on this call to voice those, or?
I'm here.
I see Christine.
Christine, please.
Okay, so in general, I don't think we had too many issues. We talked about some of the LID implementations in various types of zoning applications. So I think I can let Mr. Keeley or Ms. Coleman elaborate on those if the board would like further elaboration.
Yeah, please do. And LID is low impact development, and that's where my questions originate also. So, Mr. Keeley, please.
Okay, so the new permit does require us to implement low impact development wherever feasible, and require it from permittees on projects, as well as do some of our own on municipal property. But so the key, I know that your board is concerned about the residential application of stormwater LID. So there's a couple things about that. We're probably not going to be looking at too many more residential subdivisions, so that's not going to come up too often. But the feasible part of the requirement by the EPA is the key. If it's deemed infeasible because of a Board of Health regulation, we simply won't require it in that type of application, a residential property.
Well, let me put this way. A little more than a meeting ago, 2 meetings ago, we approved this large a subdivision. We are in the process of reviewing another subdivision as we speak. In addition, we are having more and more and more redevelopment in the community. And the board is concerned about one statement, and I'll read these 2 sentences, if you will. Low impact development techniques where adequate soil, groundwater, and topographic conditions allow. These may include, but not limited in, impervious surfaces, disconnection of impervious surfaces, bioretention, rain gardens, and infiltration systems. Our regulation does not allow for residential detention basins or any basins which hold water, and we are still suspect to rain gardens. One of the members just spoke to me recently and said that, we still haven't had one that worked. So to that end, we're a little concerned about that one statement. I'm asking that you just add what statement in, Mr. Keeley or Larry or Mr. Cohen, something there, because it's not what you just said, which is absolutely correct, is the fact that I don't want proponents coming to us and saying, we have to do this with conservation and you won't allow us to do that. So we're confused and we have to go back to the drawing board. I just want to speak with one voice. I know that our Director of Public Health had a statement to that, and she spoke to me about that also. Susan, would you weigh in here?
Yeah, I mean, I think you hit it right on the nail right on the head, in that, the concern is that we don't want to have a bylaw and a regulation that are conflicting with each other. I think what John is saying, though, is that there is some wording in here that says it's if it is feasible or not.
Unless infeasible.
Unless infeasible is the wording.
Yep.
And that would say, I guess what your side is saying is that because it's a Board of Health regulation, it makes it infeasible and would make it infeasible whenever it would be applied to residential area. Is that correct?
That's correct. And I think if we try to exclude residential applications explicitly in the bylaw, I think we would get some negative feedback from the EPA. We don't want to call it out to them that, you know, we're not going to apply LID in residential areas. So in practicality, we won't, but we don't want to, you know, telegraph that to the EPA.
Then you need to have you need, when you have proponents that come before you, is to let them know that in residential areas, there are Board of Health concerns. And I think I could leave it at that. Because when it comes to subdivisions specifically, the Board of Health controls those development portions. Yes, Susan.
Yeah, I just do have one question. Would there ever be an event, and I think I asked this of Christine too, and she told me no, but I'm trying to think of, would there ever be an event where it may go to the Conservation Commission and the Board of Health may not see it? And Christine said no, because we have a requirement for to fill out a stormwater application with regards to our stormwater. But I'm thinking, Christine, would if we had a smaller type of development, would it then not come to us, or would it always come to the Board of Health?
It would always come to the Board of Health. And in fact, that was part of the precipitous behind our stormwater regulation, was that Concom has purview between 20,000 square feet and 10,000 square feet and over 20,000 square feet. And we were having issues with even a single family new house being built on a demoed older house where, you know, we had, you know, a rain garden that wasn't designed properly and it failed, and we had neighbors complaining. So our stormwater regulations were written to capture that kind of small application.
So let me ask then, since we really have worked this out, and please, Larry Cohen, and I want to note that Larry has been chairman for many years, and he's been a very long time member of the Conservation Commission. And if Larry gives assurances to me, I'm very comfortable. Larry, you are on mute.
All right, thank you, Mr. Chairman. In addition to us working well together on the town business, we have had a relationship for the last 50 years or so, or something like that. And so we go back a ways. I can tell you that by practice, the way the Conservation Commission has operated, we have deferred to the concerns of the Board of Health when it comes to dealing with safety issues. I can think of a couple of projects off the top of my head where the applicant has said that we have to go redesign. You looked at a project, but we're presenting a different plan because the Board of Health, and we have always gone along with that for the reasons that the Board of Health had some concerns over safety issues of standing water and et cetera. I'll also say that the only people that come to us for a formal permit of an erosion and sedimentation control is only for 1 acre and over. Other than that, between 10,000 and 20,000, I mean, it's 20,000 square feet. And then over 20,000, they get a formal permit and a hearing. Between 10 and 20, they get an administrative set of standard conditions which are issued. And if the disturbance is below 10,000 square feet, it doesn't mean they're allowed to pollute, but they are not the recipient of even an administrative permit or a formal permit as a result of a hearing. And so a lot of the smaller projects that you might be concerned about, we don't regulate them, and we certainly would not be requiring LID on things that we don't regulate.
Mr. Chair, just if I may, one comment or question?
David, please.
Yeah, thank you. And thanks for the Conservation Commission coming today in front of us. I appreciate the partnership from our sister board. I guess my only concern, and I think this happens just as a normal course of business, that as a developer and or their their staff or their LSPs are developing the subdivision, they'll just call the Board of Health staff or probably the Concom staff and say, can you just give me a copy of your stormwater regulations? So then they go off and they develop their plans, their subdivision plans, and sometimes do a lot of work, not realizing the conflict potentially that may exist in the overlap of our purviews, right? And then they come in front of the board, and then there's time delays where we could probably have cut that off at the pass. So I'm concerned about those kind of just normal day-to-day activities where there's conflict in our stormwater regulations, where that's going to continue to happen.
Well, we have to trust the system. We have to trust the chairman. We have to trust the director.
But what I'm saying, Mr. Chairman, is that these things, they happen before they come in front of the board, right? It's the staff is working directly with the developers and their consultants, and they're developing plans based upon the two different regulations, and then they come in front of us and they say, well, we don't allow rain gardens. Well, the Concom does, right? It's down, it works down the road. Listen, I'm not saying we can solve for it tonight. I'm just voicing it as a concern that as you're still modifying and potentially still modifying your regulations, if there is a conflict, we're still going to have that issue.
May I just chime in very briefly here? Just to say,
Sure, please.
Just to say two things. Staff is very heavily involved in developing this bylaw. So if we're offering advice, we know what the Board of Health's preferences are and what you regulate. And also just to say that the wording that we're proposing does say these may include but not be limited to. So we're not saying you have to have a rain garden. We're just saying, because there's lots of other ways of dealing with stormwater and with doing so in a low impact design fashion. So there are other means of complying with this permit.
I guess I have no problem with anything here and any of the dialogue. I'm just worried, Larry Cohen and I go back 50 years. I'm just thinking, are we going to forget this 50 years from now when he and I are sitting in front of this group? And I'm thinking of something long-term than just us. And I understand you don't want to put a statement in. I do understand that. But I think maybe when people come before you, you should have maybe a single sheet of paper, that will tell people that please speak to the Board of Health before you spend a ton of money putting together drainage plans.
Let me ask, Mr. Chairman, what is your the board's position with respect to rain gardens and detention basins on large projects, for commercial projects?
We only refer to our only issue that we have are safety issues in residential areas. We have many detention basins in commercial areas around this town, many, but only we do not have them, at least over the last 31 years or 32 years coming up, in residential areas.
Understood. That was my understanding as well.
Yes.
And so actually detention basins are sort of the antithesis of LID. They're a centralized collection system where you put it all in one place. LID is to disperse the water and get it in the ground as close to possible as where it fell. So LID, does not encourage big detention basins.
Or any detention basins.
Yeah, I mean, I think our bylaw, and I don't know the exact wording, but I think our bylaw talks about no standing water whatsoever for any period of time.
So what do you need us to do tonight, Larry?
Well, I'm not sure there's anything formal you need to do. We're here to answer the questions. John, do you think we're asking for a vote, or Eileen, at all?
If the board would be willing to provide us with a letter, a very brief letter, a statement, just to say that you're in support of the bylaw, that would be helpful as we go forward with our other with other boards, if you're open to that.
I am open to that as long as we can include in that letter the discussion with standing water. So we have a letter, we have something that that will go in the files that at least acknowledges how we feel about standing water in residential areas. How do the other Board of Health members feel?
Yeah, if we can put that that letter or that statement in there, I would be in favor of recommending the change of bylaws.
I agree with the statement being included.
So, Dr. Saltzman?
I would support that as well.
So, if someone will make a motion that we support, I want to make sure that I get the correct, that we support the proposed changes to the stormwater bylaw, which will be presented by the Conservation Department, and include a statement concerning standing water in residential areas, I would be happy to acknowledge that motion.
So moved.
Okay, thank you, Dr. Saltzman. I'll second that motion.
I have a motion second. Any other discussion? If not, all in favor. Libby Wallen-Jevitz,
Aye.
Dr. Wayne Saltzman,
Aye.
David McSweeney,
Aye.
and I vote aye. You'll probably need that letter for town meeting, is that correct?
Yes.
Okay, we will get it to you. Ms. Pinello, if you need me to work on that with you, I'm
We can-
available.
Yeah, we can draft something and send it over.
Oh,
for
and
your-
I
Okay.
should have included our environmental engineer. Christine, I can't see you on this, on the gallery board here. So Christine, would you also work with our director?
Yes, I will. And I'll clarify the language that is in our regulations in that statement.
Beautiful. As always, thank you very much. We want to work very closely with the Conservation Commission. You do terrific work. And I just want to acknowledge all of you for your commitment. Thank you so much.
Thank you very much.
Thank you, Mr. Chairman.
Very much.
It's a pleasure to be here.
Thank you.
Thanks, folks.
Good night.
Okay. Our next order of business is discussion Lifetime Fitness COVID-19 related complaints. Who is going to be presenting this to us?
Good evening,
Susan-
Mr. Chairman. Good evening, everybody. I'm Ben Dubin, area.
Mr. Dubin, I want to know who is going to present it from the Board of Health's
That
my
would be
apologies.
Christine.
Christine, would you
Yeah.
please present that? And then, Mr. Dubin, your floor is open.
Very good.
Sure, just a quick summary, and Lifetime has been made aware of these COVID-19 complaints as they come in. We don't forward the complaint directly to them because often it contains complaint information, but they get a verbal summary and we review it with them. Since mid-July until last week, we've had 14 complaints, and the general categories of the complaints have been use of showers, spacing of pool equipment, exercise equipment spacing, and mask wearing / social distancing. I summarized earlier that of these complaints, 4 were anonymous. So we don't know if those 4 are repeat complaints. And of the other 10, 2 were double complaints by the same individual, meaning that an individual called once and complained about a matter and called back again sometime later because they didn't see improvement and complained a second time. So with that, I can let Mr. Dubin take over.
Sure.
Mr. Dubin, you have some colleagues with you want to introduce?
I do. Yeah, thank you. Thanks for the summary, Christine. My name is Ben Dubin. I'm the area director for Lifetime in Boston. And I am the general manager of our Burlington location as well. With me, I have Zachary Delgazo. He's our assistant general manager in Burlington. So while I'm in this specific location 3 to 4 days a week, Zach is there 6 days a week. And I also have Ryan McGarry with our legal team at our corporate office, who, as we know, this is an ever-changing environment, and as restrictions come out, guidance has changed. He helps us interpret those and make sure we're adhering at a local level to the local guidance. So those are the three that we have on from Lifetime: myself, Zachary, and Ryan.
Good evening.
Good evening. Whom is speaking right now, please?
That was Ryan McGarry, in-house counsel at Lifetime, and I apologize. My camera does not like to cooperate with WebEx, so I do apologize. I'll try to get it going here, but
okay.
Troubleshooting earlier with our tech department, thought it was going, but I do apologize.
Well, here's where we are right now. We have received a lot of complaints. We need to fix this, but we also may have to make sure, and I think that the biggest issue for us is to ensure the safety of the people within our community and the people who work and come to our community. I know that you've seen a lot of the reports. I have printed out lots of reports that say that out of the top 3 establishments which become COVID hotspots, one of which are gyms. And therefore, we are very concerned about these continuing complaints about Lifetime Fitness. So to that end, we need to fix this, and we need to fix it soon, because we need to make insurances. This pandemic is not getting any better. Tonight, there was, I think, 2,500 more new cases with 25 or so deaths in the community, and this is not going to go away, and our vaccine is months and months and months away.
Yeah. I echo, Mr. Chairman, I echo your concern, and I'm sure the concern of everybody here. We want to be a partner in this. I'll be an open book for you all tonight. I've prepared a presentation that outlines a little bit about what we're doing, what we've done. I'll be wide open about what we're complying with, where we might have messed up, where we have made pivots, where we believe we're 100% every single time perfect, and where there is an opportunity for enforcement that's a challenge for us. And I'll be completely transparent here. I can't say I've been nearly as busy as you all with this. I mean, I'm sure you all are night and day thinking about this. But it is the bulk of what myself and Zach are doing, enforcing, and working on since July 6th, when we were able to reopen these doors. And we take it seriously. So I'm happy to share my presentation if you all are ready to start there.
Mr. Chair, can I make a couple comments before we start the presentation? Because I'm not, and I'll defer to the chair on the presentation. I do think there's some relevant. I read through the presentation earlier today. I do think there's some relevant information or content that you may want to share, but and you know, we have thousands of businesses, restaurants, what have you, in Burlington, and you know, quite frankly, we can't babysit this anymore, because I think that's what it needs. And whatever you're doing or have done hasn't fixed the problem since we have 14 in increasing complaints, and most of them are social distancing and face covering, which is probably the easiest problem to solve for. So while, you know, I want to give you the floor and be fair and give you the time to talk about the things that you've done, but I you know, just in the fact alone that we've had 2 more complaints this past week means whatever you're doing isn't working. And I know it's not your fault, because it's about the members complying, but it's your problem, right? And you need to fix it. And we just don't have time to babysit this, and we just need it and want it fixed. So, you know, I think I know you have 20-page presentation, and if you want to go through it, that's fine. But I'd rather sit here and go through and read through or hear about a 20-page presentation that talks about what your next steps are to fix it. And if that's canceling memberships to folks that aren't complying, or, you know, changing or hiring staff and putting them in each room. I know it's a big facility, but I think you need to fix it, and you need to fix it tomorrow, at the latest, because if you guys can't fix it, I think we can come up with some solutions from the board, but I'm not thinking you're going to be happy with them.
Yeah,
So, Mr. Chair, I'll defer. I'm sorry. Dr.
Yeah, Mr. McSweeney, you said that so well. I don't even want to talk. So, but yeah, Mr. Dubin, you guys have been before us. We've been partnering with things like the pool setup and things like that in the past. So we have partnered with you. I actually wholeheartedly agree with Mr. McSweeney. I looked at your presentation. I have to tell you, as a medical professional, I am not crazy about gyms right now at all. But being fair to our businesses, I absolutely respect your need to operate. And Mr. McSweeney is completely 100% on board. It's a member issue, but yes, it is your problem because you need to regulate your members because they can affect our community. So I, once again, wholeheartedly agree with Mr. McSweeney. I'd rather, if you wish to do your presentation, that's fine. I will end up arguing some of your statistics at the end, and I don't want to do that. So if you just want to go over what you're doing specifically to address these concerns, I would welcome that discussion instead of your presentation wholeheartedly. But I will stop there and give you the floor, given what the two of us have just said.
Fair enough. I appreciate you reviewing it. There's a combination of some statistics, which you all are much more versed in than I am. Trust me. I'm sure you know
Mr.
that already.
Dubin, if you would like to take a few minutes and show a couple of slides that you think are important, we'd be happy to see them. I have reviewed them also.
Okay.
And please understand also, there are a lot of people are watching this. In addition, this is on Facebook and it will be beamed all over Facebook tonight. So if there are some things that you want to cover specifically, I leave it in your hands. But I think what I really want to do is to come up with a solution tonight, because I think that Mr. McSweeney and Dr. Saltzman said so well, is that you won't be happy if we have to make some decisions here. And where you are not the only people we get complaints from, we're getting complaints from your institution regularly. So I leave it in your hands right now for a few minutes.
Very good. Okay. So I will only go through a few of these slides to maybe cover the talking points that I have, and I'll leave the rest. So a little about Lifetime. You know this. We have 152 locations across the country, 4 in Massachusetts market. So we're a fairly large operator. When you look at Burlington specifically, we're about 125,000 square feet. Indoor capacity at 100%. We are currently operating, as we know, less than 100%. Is 2,200 people. We currently have 119 team members, and we have 2,400 members at the current moment. Currently, we're operating at a 40% capacity, which means at any given time we can have 195 members in the club. We are averaging 767 visits per day since we opened. You can see our busiest day was under 1,000 visits, and you can see our average daily visits per hour. So during the evening time of our busiest hour to 2 hour period, we're much under that 40% capacity, with maybe 200, 250 people in the building on average during our busiest time, with a maximum capacity of 895. Throughout the facility, we've implemented a number of changes. We actually developed a playbook consisting of 400 pages of changes we've made within the club. One of the largest is our enhanced cleaning protocols, with our team members disinfecting high-touch surfaces frequently. We've set up cleaning stations throughout the facility for members to utilize a neutral disinfectant and hand sanitizer, disinfecting wipes. We've probably multiplied the amount of available ready cleaners and the amount we're cleaning our clubs 10 times since before the pandemic. All of our cardio equipment is spaced out by 14 feet. All of our free weight resistance equipment is spaced out a minimum 6 feet. The mask requirements under the sector-specific guidelines in Massachusetts do allow fitness centers to have their patrons remove their masks if they're 14 feet away from other patrons. Our guidelines, our rules that we enforce here at Lifetime are actually more strict than those requirements by the state. We only allow masks to be removed if our members are at a place, a station that's already been measured 14 feet apart by Lifetime. For example, probably 1/5, 1/6 of our cardio equipment is open today because of that 14-foot spacing. We require members to walk to that treadmill or that Stairmaster with a mask on, remove the mask while they're on it, and put it back on before they leave it. That way, there's no way a member is coming within 14 feet of that member while they're on that piece of cardio equipment. We require that mask at all times in our free weight floor. We require it at all times in our resistance training floor. We require it at all times walking throughout the club. And we enforce that and monitor that all of the time. I can tell you on our fitness floor, we are 99.9% compliant with mask usage over both mouth and nose. We have people zoned on that floor, personal trainers and operations teams, and we have a manager on duty from 8 a.m. to 9 p.m. enforcing that. We see it, we address it, and our members now are in that habit and that routine of putting on the mask over the mask and nose unless they're in one of those stations, cardio equipment, that's spaced out from other members by 14 feet. We also require masks in our locker rooms. And while we may be 99.9% compliant on the, one more point before I leave the fitness floor, we did receive complaints, especially when the new executive orders 53, 54, and 55 were released by Governor Baker a couple weeks ago. And Christine and I did connect about this. Multiple complaints, I believe multiple, Christine, correct me if I'm wrong, were about masks not being worn on the fitness floor following Executive Order 55, which stated that masks essentially need to be worn at all times in all establishments. It did say in that executive order that sector-specific exemptions still do apply. So for example, if you're at a restaurant, you can remove your mask while you're sitting at a table. If you're at a gym, you can remove it while you're 14 feet distanced at Lifetime on a piece of cardio equipment. And after connecting with Christine, I do believe that there were some members who were unaware we still had that sector-specific exemption under Executive Order 55 that members could remove that mask when 14 feet distanced in fitness centers. I do believe some of those 14 complaints we received were complaints about that. Back to the locker rooms. While we might be 99.9% compliant on our fitness floor because our members get it, I do believe we're about 90% compliant in the locker rooms, and that is not good enough. We did put up another sign in all of our locker rooms saying masks must be worn if you're going from your locker to the pool. Now, a member might come from work, throw on their bathing suit, take off their shirt, and walk from the locker to the pool. They don't want to wear a mask when they do that. We are actively enforcing the fact that they have to. As I said, I believe we're about 90% compliant there. We've received complaints on that. The showers are only for members that are utilizing the pools. We have to have showers available for members that are swimming in pools. We have signs posted that the showers can only be utilized by members that are swimming in the pool. We have had complaints that members that are working out are using those showers. That is one that I can't guarantee we're 100% compliant with. We've posted it. I would struggle to put a team member in the shower area asking what area of the club members are coming from. So the complaints about a member using the shower that was not coming from the pool and a member in the locker room not wearing a mask, I will agree. We have opportunity to enforce that. And if there is one takeaway from this, and there might be multiple because we're not perfect, I'm willing to listen to everything that this group has to say and act on it. But there's one that I know we will make right away is to have a higher presence in that locker room. We've already posted additional signage so that when members are going from pool to shower or locker to pool, they don't just grab a towel and put it over their face or just walk to that pool. They do wear their mask and leave their mask by the pool where they're swimming. It is our responsibility to make sure they're wearing that while moving throughout the club at all times. So these are the main points. I think I've covered the vast majority of what the complaints are, and I'd be happy to talk through and answer any more questions about those complaints. Just a couple of other points regarding our air filtration. We've installed MERV 13 filters throughout the facility. So these filters are designed to capture 98% of microparticles from the air, including bacteria and droplets. That investment was made before our clubs reopened on July 6th. We know that temperature screenings aren't perfect because asymptomatic people may not have a temperature, but we are temperature screening all of our members that walk through the front door and all employees on each visit. Our group fitness classes have moved to the gym and are 14-foot distanced in our gym with equipment sanitized before each class to ensure that a member doesn't have to touch any equipment that wasn't sanitized. And you can see our limited capacities as well for those classes in the gymnasium and in other areas of the club. So I think with that, I'll attempt to stop sharing. I've covered most of the points I wanted to cover, and I would love to answer any questions or take any feedback from this group so we can continue to be a partner here in helping keep everybody safe while staying open to help our members live healthy by strengthening their immune systems.
Are there any other questions for Dr. Saltzman?
So, Mr. Dubin, thank you for your brevity, and I just want to say that I respect and appreciate your role and your passion for your business, and what you all do for the community. And I definitely appreciate the fact that maintaining fitnessism is important, especially during this time. My greatest concern always, I've been very consistent on this, as my colleagues know and as our community knows, is on hygiene. And and as someone who was, before this pandemic, going to the gym frequently, I was always amazed at the lack of hygiene before and after use of equipment, hand washing, etc. So as part of the state mandate for facilities, I know that you have hand sanitizer available throughout. I've been to Lifetime, so I know these things. But my concern is how you monitor folks before and after use of equipment, hand sanitizing, cleaning down equipment after every use. I'm really interested in how you are able to monitor and enforce disinfection techniques.
Thanks for that question. I would tell you first and foremost that it's something that we've always asked our members to help with and be cognizant of for a long time, right? Well before the pandemic. I have noticed an absolute change in the behavior of our members, with our members truly trying to do their part and be cognizant of wiping down their equipment after use, and in many cases before and after use. I appreciate that, and I have noticed an absolute difference. There's also things that we've done to obviously do our part in this. So we have, one of the things we've done is we've actually set aside at all times of the day a member from our facility operations team that is zoned specifically on our fitness floor. So if you walk up on that fitness floor at all open hours, you're going to find a member of our operations team that's doing lap, refilling sanitizer stations, refilling the disinfecting wipes, but also doing laps and wiping down all the high-touch surfaces for members. That includes the upholstery on a bench press, to the dumbbells on a rack, to the handles on a cable cross machine. In addition to that, we have fitness professionals, personal trainers that just simply work on our fitness floor. I would say, unfortunately, they were probably serving about half of the number of personal training clients they were making a living serving before the pandemic, but they've been doing a fantastic job of utilizing that downtime, call it the 20 hours a week, 25 hours a week they're not with the client, to also make a lap and disinfect those high-touch surfaces as well. So while it would be literally impossible for me to see everything a member touches and puts back, a combination of my facility operations team, my personal training team, my manager on duty that is also a minimum of once an hour making a lap on that fitness floor to make sure all those parts are working the way they should, and our members doing the right thing make this place as safe as possible when it comes to disinfecting before and after each use. I'm highly confident in that.
Thank you, Mr. Duke.
Hey, Ben, could you maybe speak a little bit to the group, some of the, just how we've set up the group fitness spaces and the equipment specifically too, sort of the before and after classes? I think that's pretty helpful too, because I think certainly the group spaces is something that is a little bit different than our fitness floor, but we've done a really, I think, a really nice job with that.
So our fitness floor, right, your cardio, your free weights, that's going to be the highest penetration area of our business. So most members that walk in the front door, they go on the fitness floor. The second most is going to be our large group training classes. So that consists of your cycle, your yoga, and your group fitness classes. So we've moved the majority of those classes to our gymnasium. Here in Burlington, we have 25 bikes on one side of the gym. And in between those bikes, we've got mats. So when there's a cycle class going on, you have a bike, 7 feet, a mat, 7 feet, a bike. There's no one on the mat during the cycle class. There's no one on the bike during the studio class. So you have 14 feet between members. They can get to their bike. They can remove their mask. The instructor has a stage a far way away from all participants. The gymnasium is huge, multiple stories, open air. And after the members leave for that class, the instructor, before they leave, takes our sprayer. It's a big tub with the spray nozzle, and they spray down our sanitizer on everything a member would have touched during that class. That could be the handlebars, the console of the bike. That could be the dumbbells, the resistance band that they're using. And then there's a 30-minute period minimum between classes. So if there's a cycle class and then a studio class, it gets sprayed down. It's left for 30 minutes before the members come in for that studio class. That covers the 2 areas of our club where the most of our members come for a visit at Lifetime. The other thing to note is that we are a large facility with multiple studios, a gymnasium, a sprawling fitness floor, multiple indoor bodies of water. So when we have 200 people in the building at once, they're not all in the same place, which is beneficial.
Well, let me summarize this a little bit. We find no joy in bringing you here in front of us and being public. We find no joy in doing that. But clearly, some of your clients have been so uncomfortable, they actually picked up the phone or they sent us emails. Our job is the same job as you have, and that is to keep this community safe and well. You need to be vigilant in an environment that is now becoming involved in pandemic fatigue when people are just tired of doing it. But you need to be vigilant because it's your business and it's our business. I'll open this up to the board members one more time, or our professionals, but we clearly understand that you need to do what you need to do, and we need to be ensured that you're doing what you have to do, and I think you are. And we need to be ensured that things are going to work as things change and continue to change within this pandemic. So I'll ask any of the board members or our professionals if they have anything else, and then I'm going to have to believe that you'll step it up a little bit, because although we like you, we really don't want you here again.
Yeah,
I like you all too, but I don't want to be here again either. So we will.
Yeah, Mr. Chair, I think you said that very well. The board has a history and reputation of not only representing our community, but being very fair to the businesses that serve our community. And so just your coming here, Mr. Dubin, with your team indicates to us, and obviously you've said it many times, how serious you are in making sure that our community is safe. And so I am willing to part ways, knowing that you are going to be doing your part with your team, or continuing that in support of our community, and obviously in support of your members. So I thank you very much for you and your team coming here tonight and speaking with us, and look forward to whatever is to come during this this crazy time. So thank you.
Libby, do you have anything to add? You're on mute.
It sounded to me like you have some very good procedures, from my knowledge of, antisepsis and all of that stuff. And I think the thing we all kind of have to remember is that it's our own personal responsibility to, number one, comply with the policies of the establishment, and number two, to just protect yourself so that you protect others. And I think personal responsibility has a lot to do with it as well.
Mr. McSweeney, are you all, is there anything?
Yeah,
else you'd like
just some parting comments. Mr. Dubin, thanks for the presentation. I know there's a lot of information in there, good information, and you are doing quite a bit. So don't take this as not that we feel like you're not doing anything, because we enjoy Lifetime. We were excited when you came into the community. I love that the facility is gorgeous. I love the facility. I think it's a great place, and you support the community in a lot of different ways, not just in health, but there's some social aspects that you support as well, and I like that. But I think I would just say, hopefully you heard our message loud and clear that there's some things that you still need to fix. And I echo Dr. Saltzman saying that I believe and I have faith in you after hearing you speak, that you are going to continue to be vigilant and fix those things that come up. We just need the issues to get resolved. So thank you for coming in.
Our professional staff, Ms. Johnson, Mathis, or Luminello, do you have anything else to add, or would you like to say anything? If not, Mr. Dubin, thank you for coming. And we have faith. Have a wonderful holiday. And for all, I guess, for Mr. Delgazio and for, I'm trying to see who else, Mr. McGarry and yourself, have a wonderful holiday. And to that, we'll just, let's move on and please do what you have to do. Thank you so much.
You're welcome. Thank you very much.
Thank you. You as well.
Thanks, folks.
Okay, which brings us now to staff reports, environmental engineer. Christine, you have been so busy. And thank you for being here tonight and helping us bring these topics forward. Do you have anything to report?
Sure, I wanted to update the board on the 101 Middlesex Turnpike property. I have communicated with their attorney, and they did obtain the required permit that they needed from Natural Heritage, and they are going to do the dredging work and cleaning work in January.
That's awesome. Thank you, Christine.
Any other questions? Good. Any questions for Christine?
I actually have a question that wasn't on your report, but where do we stand with and they have since moved, but the old Burlington Auto Parts drainage issue? I noticed that still hasn't been complete yet, and we're coming into another winter with the ice freezing over on the sidewalk. I don't believe it's been completed, correct?
No, they haven't completed it. They had a lot of, they had some tenants move out. I haven't gotten an update from them, but I've been meaning to. I do take a look at it every time I'm up and down Cambridge Street, which is often, and mostly because we have low groundwater this year. I really haven't, even in the warm months, I haven't seen any, not even trickles coming into that catch basin on Cambridge Street. So unless we get a ton of high rise and groundwater, I don't think it'll be an issue over this winter, but I will address it and get an update on when they're gonna continue with that work.
Yeah, that'd be great, because I know they presented a plan and we approved it. It would be good to get the work done on it. Thank you.
Yep.
Dr. Saltzman.
So just to segue off of Mr. McSweeney's question, how about the area of retention behind the Wendy's, Orange Theory, that complex? Is that moving forward at all?
Behind them?
You know, the parking lot that had,
That's the one I was just referring to. The one.
I thought David said Burlington Auto Parts.
Yeah,
No.
no, yeah, her statement before that one was an update on
Got
the
it.
Wendy's parking lot. Yeah.
Got it. Thank you. Sorry.
Yeah, so they got their permit and they're gonna be starting work in January.
Great. Libby, do you have anything to ask? Okay, she says no. I have two quick things. First is we have an installation of an irrigation well in the midst of everything that's going on. They understand that they cannot use that irrigation well during droughts, correct?
They do, and they're scheduled to attend our next meeting.
Okay. And second question has to do with a potential biotech company in Burlington. I predicted we'd see lots and lots of these. Was this anybody specific, or is this just specific questions concerning people moving here?
It is a specific company, and I do intend to have a subcommittee meeting on this, probably early to mid-December. It's kind of a unique application. They install and then rent out individual or multiple clean rooms to different entities under the same umbrella of one large building. So it's unique in that it's not just going to be one tenant. So hence the request for a subcommittee, which I can reach out to the board on that in the coming week or so.
Thank you. That's all I have. Then no other questions. Can I have a motion to approve?
Second.
So it's Libby Wallenjever, second by Dr. Salzman. All in favor, David McSweeney. David?
Sweeney.
He's
Hi, sorry, I couldn't get it off mute.
okay. Dr. Wayne Salzman.
Aye.
Aye. Libby Wallenjevitz.
Aye.
And I vote aye 4-0. Second is health agent, and I'm going to ask Marlene, are you going to also entertain the associate, the assistant health inspector's report too? Or will all of those come under the director?
Well, that will come under the director.
Okay.
I can
Marlene,
do my
please.
report.
Thank you. Give us some
Sure.
highlights, please.
Sure, okay. So we completed the food service establishment permit renewal, so everybody's renewed. We do have some corporate cafeterias that had asked for an extension. They're not sure if they're going to open by the end of this year, or I'm hearing now that they think they're going to be opening or reopening in the spring of next year. So that just remains to be seen. Some of them did renew, even though they're not open. I did reach out to them as well, and the same story that they're probably not going to open until the spring of 2021. Right now, we're in the midst of our retail tobacco permit renewals. Those are all due by December 15th. We've got probably about half of them in already, so we're doing good there. And then on my report, I had an email that was sent out to the food service establishments about the new closing time. And I just want to clarify to the board, because we got clarification at one of the DPH meetings, that as far as restaurants, so the 9:30 p.m. closure, in the email that went out, it was communicated to them that everybody had to be out of the restaurant by 9:30. The clarification we received is that they would have to have their food and beverage on the table before 9:30, but they could stay in the restaurant and finish their food and beverages up until 10 p.m. So at 10 p.m., everybody has to leave the restaurant. So I just wanted to mention that to the board, that clarification. And is there any questions on my report?
David?
Nope, none from me. Thank you, Marlene. It's great.
Libby?
No.
Wayne? We can't see you. I'm going to assume not, Wayne, because we can't hear you or see you. I just have one quick comment. I counted in the month of October and November, from October, actually for the month of November, you were involved in 58 in-depth activities. Just to point out how busy your office is. And I want to thank you so much for all of that. I could go through them over. It's letters, it's reviews, it's inspections. 58 is terrific. Thank you so much, Marlene.
You're welcome.
Dr. Saltzman, are you okay?
Yeah, I am. Sorry, I'm having problems with my video. Motion to approve the health agent report.
I have a motion by
Second.
Dr. Saltzman, second by David McSweeney. All in favor? David,
Aye.
Wayne,
Aye.
Libby,
Aye.
and I vote aye 4-0. The last one on our agenda is Director of Public Health, which also includes the nurses report and the assistant health inspector.
Yeah, so I just wanted to let the board know that, I mean, as you can imagine, our caseload is going up every day. So we have a lot of case investigations to do. So one of the things that we've done is hired a part-time temporary nurse to help us out until the end of December. We're going to use COVID funding for that. So she's going to start on Monday. Her name is Regina Harris, and she'll be working 20 hours per week approximately. And she'll be in the office some of that time, but she'll also be available to help out on weekends and holidays and that type of thing, because the cases are coming in all the time. One of the things that I learned today was that MRC volunteers are now going to be allowed to get onto Maven. So I sent out a message today to some of our MRC volunteers, the nurses who are interested, see if they may be interested in helping us out with case management and being trained on Maven. So I have 2 MRC nurses who are interested in that, and we're going to move forward with getting them trained on Maven and onto Maven so that they can help out with case management too. So I'm expecting more cases to be coming in as we move forward, and I just want to be prepared for the type of surge that we may be coming into.
So I'd like to do this first. Does anyone have any questions from Ms. Hardy's report? Anybody? Wait, nobody? Okay. The second is, do we have any questions around the nurses report? Libby says no to. Okay, which now brings us to the Director of Public Health report. And I think Dr. Saltzman, you had a question? No.
No,
Mr. McSweeney?
I purposefully, Mr. Chair, leave our director alone because she's so busy.
She is so busy. David?
No, I'm good. Great work, though.
I just want to point out a couple things, and it's not a question. The types of things that our director is dealing with, not only multiple complaints, a lot of telephone calls concerning COVID, teleconferences, but also communicable diseases and surveillance. She's helping out with cases in both Salmonella, Legionella. She's involved with union representatives. She's involved in every aspect of this community. And I bring this up because so many people are going to be watching this. And I got to tell you, we are all out straight. I called Susan, our director, on Monday morning, and I said, how many cases have you worked on over the weekend? And it's never 0. It's always something that she's involved in. I had to call her this weekend too over some issues that I got asked. So Susan, on behalf of the community, on behalf of the town of Burlington and this board, I thank you all so much.
Thank you. And we also have an amazing staff at the Board of Health. And I couldn't do it without the staff that we have there, because they all pitch in and they're all willing to help with things that come up, and all different kinds of things are always coming up. So I appreciate the staff that we have.
Thank you. Marlene, thank you so much. Christine, thank you so much. And I know Samantha, I know Sarah Cathcart, I know everybody who was involved in this. Thank you so much. Thank you for our recording secretary. So thank you so much for everything. I have nothing else. Is there anything that Anyone would like to close with?
Motion to approve the Director of Public Health report?
Thank you. Do I have a second?
Second.
All in favor? Mr. McSweeney?
Aye.
Dr. Salzman?
You're welcome. Aye.
Libby Wallenchevitz?
Aye.
And I vote a 4-0, and thank you, Dr. Salzman. If nobody has anything else to close, I'm going to call upon Dr. Wayne Salzman, noted physician and geriatrician, who, as always and traditionally now, closes our meeting.
Folks, we're in it again. You all know that. We have a wonderful community. We have wonderful support. We have good citizens. Thanksgiving is a tough time to not be with family, but as I told my brother-in-law, with whom we typically spend Thanksgiving every year for the past 30 years, I said, I'd rather miss this year so that we can be together next year and every year thereafter. And what we have to remember in the middle of all this is that social distancing, mask wearing, hand washing, and if you're not feeling well, keeping yourself isolated really are the names of the game. Please, if you can, if there are no contraindications to your doing so, please get the flu shot, please. And COVID-19 will be soon forthcoming, but there is some science that we need to do. But at the end of the day, I wish you all well. We are all in this together. Hand washing, hand washing, hand washing. Thank you, Mr. Chair.
Do I have a motion to adjourn?
So moved. Second.
Okay, Mr. Sweeney. Second by Libby Wallenchevitz. All in favor, Mr. McSweeney?
Aye. Happy Thanksgiving to everybody, too.
Dr. Salzman?
Aye.
Ms. Wallenchevitz?
Aye, and thank you. Happy Thanksgiving to everyone.
And I vote aye. Have a happy, healthy Thanksgiving. Be well and be safe. Good night, everybody.
Good night.
Good night. Thanks, everybody.